I'm going to show you how to stop a panic attack during pregnancy. I've looked at some of the other information around and a lot of it feels quite vague and just about how to feel calmer, whereas this video is going to give you specific actionable advice about how to stop a panic attack during your pregnancy. I use this information every day in my work as a postpartum therapist, helping hundreds of women to recover from panic attacks and to feel better and manage anxiety. So let's jump into the information so that you can too. So firstly, what is a panic attack? It is usually an experience which is really scary or distressing or sometimes even terrifying. It can feel so awful when we have panic attacks. And usually if you are having a panic attack, you will experience physical symptoms in your body and they will feel very strong and intense. So some of the physical symptoms that you may experience are heart beating really quickly or fast, breathing changing and breathing or feeling like you can't get enough breath. It may feel like you've got a pounding head. You may experience numbness in parts of your body or, for example, weak legs. You may feel really sick. You may feel like you can't swallow, or you may get this feeling that you're going to faint. These symptoms, you may not experience all of these symptoms and you may experience a few of them, but what makes a difference, so rather than just having an experience of anxiety, because we can experience all of these just when we're feeling anxiety, but what makes it into a panic attack is when we experience these all at once and they come on very quickly and closely together. And usually when it is a panic attack, we often feel like something awful is going to happen. So as a cognitive behavioural therapist, I call this a catastrophic misinterpretation. And so this basically means you think something terrible is going to happen. So for example, you might think, I can't breathe, something bad's happening to the baby, I'm going to faint, I'm going to pass out, I'm having a stroke, I'm having a heart attack. All of these things are going to make your anxiety feel worse when you're experiencing that belief that something bad is going to happen. Right, so what happens during a panic attack? I think the best way to show you this is to draw this out on the screen so that you can see exactly what's going on. I use this illustration with my clients all of the time and I have had so much feedback how helpful it is, and seeing this can help manage that panic almost immediately. So I'll see you over in my presentation slide. On the screen is a diagram which shows what happens to you during a panic attack. So we experience a trigger that causes anxiety. This goes on to cause physical symptoms in our body. And then usually we experience a catastrophic misinterpretation. Essentially, we think something bad's going to happen, which makes our anxiety worse, which makes the physical symptoms worse. So let's have a look at an example. So imagine if you experience the trigger of, I've done something to hurt the baby. Maybe you're thinking you ate something bad for the baby, for example. And so because of this, you experience anxiety. And then you go on to have physical symptoms of that anxiety. So maybe you feel breathless, your heart is racing, you're sweating, or you get a feeling of unreality. Things don't feel real and you feel dissociated from what's going on around you. Then once you have these physical symptoms, maybe you start thinking something bad's going to happen, like I can't breathe. For others, it may be that I'm going to faint, I'm going to pass out, I'm having a heart attack, whatever that is. And what happens in this situation, if you feel like you can't breathe, your anxiety is going to get worse. And therefore, those physical symptoms are going to get worse. And then you're going to feel like you can't breathe more, then your anxiety is going to get worse, then the physical symptoms get worse. And so you can imagine this is where we escalate into a panic attack. And so what do we decide to do when we are experiencing this? Completely understandably, we're going to want to get out of the situation. So we do what we call safety behaviors, things that we think are going to help us, but maybe in the long run, they make things feel worse. So lying down, taking herbal tablets, drinking water. In really severe cases, you might call 999. And some of these things, actually, it's not the worst thing to do. But with safety behaviors, we start thinking that we need to do those things to keep ourselves safe. And without them, we wouldn't be safe. Whereas actually, all of these things, although they may make you feel more comfortable, they aren't actually necessary, because managing a panic attack is a lot more simple than that, and we don't need these things. Okay, so how do we stop a panic attack? There are two main options, and on the screen I'm going to show the first, but the first is the least helpful. And you will probably have heard of taking deep breaths to manage a panic attack. That's what we would instinctually be told. That's what other people tell us. But actually, I'll show you why that can be unhelpful. So if I am experiencing a panic attack here and I'm having all of these physical symptoms, what happens to my attention during these physical symptoms? The attention is going to go onto my body. And when the attention goes onto my body, that anxiety is going to feel worse. I'm going to feel like I can't breathe more. And so, although actually taking deep breaths to regulate our breathing can be helpful, and it could be helpful because maybe you're slowing down the process and breathing slower. However, very often it can have the opposite effect, where actually it makes us feel worse, because when we take deep breaths, we are again focusing our attention in on our body, and therefore that is making the anxiety worse. So instead, what can be much more helpful to manage a panic attack is to focus on your surroundings. You move your attention away from your body and you focus outwards. We want to take this attention away from these physical symptoms, and we want to focus it on the room around us or what's going on outside of us. So some examples of what you could try is counting the bricks on your wall. You could be looking out the window at nature. You could be speaking to somebody and really focusing on what they're saying, looking at the leaves on a tree. Maybe intuitively, sometimes people will choose to try and read something or focus that attention away. And each time you find your attention drifting back onto your body and your panic increasing, you want to focus that attention back away again. So that is actually the key to understanding how to stop a panic attack. Okay, so let's recap and review what you can do to help stop a panic attack. Firstly, it's really, really important to remember to move your attention away from the physical symptoms that you're experiencing out onto your environment. Find ways to bring your attention away from your body and keep practicing this. The more that you practice this skill of moving your attention away and realizing that the anxiety will calm itself down, the better you'll feel able to cope. Next, it's important to remember that anxiety isn't dangerous. Although it can feel really dangerous and it can feel terrifying and scary, you are safe and you are okay. Depending on what your own interpretation or what your own fear of something bad happening is, you can challenge that idea by remembering that anxiety is not dangerous. Next, find ways to lower your overall levels of anxiety. So rather than just in that panic attack when you're coping after something's happened or during something happening, try to work out how you can manage anxiety in other areas of your life. So it may be changing life situations or dealing with difficult dynamics going on in your life. It may be self-care and ensuring that you're looking after yourself, spending time outside, being in nature, walking barefoot on the grass if possible, reducing blue light from your screen, reducing any caffeine that you may be using or having, spending time with friends who understand you, making connections with other people or other pregnant mums who might understand what you're going through. Find ways to cope with that anxiety so that this build-up of panic is much less likely to happen. And with that, I would suggest you don't necessarily need to see a therapist, but a therapist would be able to help you to work through some of this. And often with panic, as a cognitive behavioural therapist, I have seen people and pregnant mums that I've worked with feel so much better in literally a matter of a couple of sessions, 2-3 sessions sometimes. And that is definitely not a promise to you who's experiencing it, but that does happen. The more that you practice this idea and work with a highly qualified therapist who can just understand what's going on during this panic and help you make the moves to recover from it, it'll be something that you can work on to help manage that anxiety. If you would like therapy from me, then I have my website Looking After Mum available on the screen now, or you can access the link in the bio, and you can contact me to see if I have any availability if you feel like we could be a good fit together. And may I recommend that you watch this video, How to Calm Anxiety While Pregnant, because this will help give much more support and advice about how to manage general levels of anxiety as well as just the panic attack. Thank you for watching.